Hello, Internet, and welcome to episode 225 of Verbal Graffiti with your host, Brian Glass, a.k.a. the B-Man, the People's Degenerate. Did you see that? Right before I introduced you to episode 225. And again, thank you for being here and listening and or watching. But if you were watching, you saw me reflecting. That was self-reflection right there. But more than that, it was self-loathing. That's what I was doing, all because of this. Very similar to being, you ever play varsity sports? For me, it was JV. I was not athletic enough to play on the varsity team, but often I'd play JV basketball, get into the game, airball 2 threes. The coach would pull me out. I'd go to the end of the bench because I knew I wasn't going to get to go back into the game. So I went all the way to the end of the bench, put my head down, and thought about all that practice, all those jump shots, all the preparation. And then when I got in the game, I failed. That's what I was doing right before this episode. I was self-reflecting, not on sports, but on this. And Dunkin', not coffee. No. This is hot chocolate that is now room temperature, and there's about this much left. And that self-loathing is self-hatred, disgust in myself. Hey, I don't know how you fatties do it. I don't say that term with malice. I just use it as a descriptive term. If you're a fatty and you've lost weight, how do you keep the weight off? Because it's so easy to have a treat that has empty calories of all those calories you left or you lost. Well, you know what I'm talking. You gain weight, you lose weight. It's all about calories. And in America today, you have one hot chocolate, and all the gains you made are lost. And I was having such a productive day. I went for a 4-mile run. I got a nice lathered up sweat. I did a little bit of yard work. I did actual work during my day job. And then my sister, my lovely sister, came home. And she listened to me a few days ago. I said I was craving hot chocolate. And then so she got me a hot chocolate. She was getting a coffee for herself, and she got me a hot chocolate. So, of course, I drank it. But all those gains I made out the window into my belly. And now I have that chalky, hot chocolate mouth. You know the mouth you get after hot chocolate, and it's on your teeth. And I'm disgusted with myself for drinking this. But I have no willpower. If someone offers me hot chocolate, the B-Man's going to drink that hot chocolate. How can you not? How can you not drink hot chocolate, especially when it's gifted to you by a loved one? And if you love your sisters and your brothers, tell them so. You're not going to listen to me, so Fuck. How do you do it? How does anybody thrive in today's society? You know, I was thinking, and I think the B-Man might be the only person to make this comparison. This is what I was thinking about when I was drinking this. I did enjoy the taste of the hot chocolate. Oddly enough, I'm addicted to coffee, but I don't really love the taste of coffee. Love the taste of hot chocolate, but I'm not addicted to hot chocolate. Maybe it has something to do with the caffeine. There's no All right. The comparison I was thinking about when I was drinking this hot chocolate is I enjoy the taste of hot chocolate. So I was thinking, well, if the option was given to me, hey, you could drink hot chocolate or you could suck on a big fat titty, which would you choose? And I actually did give it some analysis and some reflection. And I pondered, if the proposition was given to me, what would the B-Man do? Now, obviously, I would suck the big, fat titty. And when I say fat titty, I'm talking about the areola. I like a nice silver dollar or small plate. We've talked about this. I'm an areola man. The B-Man, I love areolas, especially two. Right? I like symmetry. You know, Picasso, go fuck himself. There's nothing symmetrical about a Picasso painting. I like symmetry. That's why I like my boobs in pairs of 2, which usually they come in. Thank God for that. Thank the Lord for that. And I hope you had a happy Easter. But it is odd. Because I don't, like, I like sucking titty, nibbling on the tit, but I don't like the taste. There's no taste to it. Like, actually, I enjoy doing it, but I get nothing from it. Sucking the tit, that is. Like, I drink hot chocolate, and I love the taste of hot chocolate. You know, it's empty calories. It's who doesn't like chocolate? That's un-American not to like chocolate, especially in its melted hot form, liquid form, that is. So I love the taste of hot chocolate. So it is odd that I would choose sucking the titty. But in the titty's defense, sucking a titty is more memorable than drinking hot chocolate. Does that make sense? Like, in the moment of the two, like, in the moment, I just repeat, I'm trying to hash this out right now. And that's why I'm not able to enjoy life, because I'm unable to enjoy a hot chocolate. I drink a hot chocolate and immediately I go to self-loathing and disgust for myself for drinking empty calories and making myself a sloth, just ugh. But I love the taste of it. But it's so in the moment, like, I'm enjoying the taste, but I'm hating myself. But again, when I suck a tit, I get no, unless she's pregnant, God forbid, because I don't like milk. But generally, when you suck a tit, like, there is no taste to your nipple, unless you're sprinkling salt or pouring a little bit of margarita on it. But it takes a variable to put on the tit to make it tasty. But a tit itself, the nipple, has no taste to it. So when I'm sucking a tit, maybe your tit, like, I really get no pleasure from it. It makes me horny, but if that's all there was, like, if there was no act before or act to come after sucking the tit, and the only act that took place was sucking your big fat titties, it's not tasty. Does that make sense? It's an act. I'm not getting any pleasure from it. Again, it makes me horny. But if I were to suck your tit, walk away, and no other touching, no other groping, and we both went our separate ways, you and your big fat titties, two of them, and me wherever the fuck the B-man goes, it's pleasurable, it's enjoyable, but it's not. But that's all it is. All right? There's no taste to it. So but it is a memory. I think what it is, a long way what the B-man's trying to get at is that in the moment, drinking hot chocolate is enjoyable. But with sucking a big fat titty or two of them, it's memorable. All right? Like, a year from now, I won't remember this. I will not remember this hot chocolate. I'll vaguely remember the taste. But if I suck your big fat titty, 10 years from now, 20 years from now, till I'm on my death's doorstep, I'll remember sucking your big fat titties. So that's the conundrum. Do I take the instant gratification of the taste of the hot chocolate, or do I take the long-lasting memory of sucking a big fat titty, and possibly two of them? But that's it. Right? There's no other sexual act that takes place. It's a suck the tit, walk away. Which would you choose? I would think that most heterosexual men, maybe even gay men, and women too, babes, would probably choose to suck the titty. Because again, like, who doesn't want to suck a titty? But the more I talk it out, I think choosing to drink the hot chocolate is the correct answer. And this all might be age dependent as well. A 20-year-old me wouldn't even be contemplating. It'd be, yeah, give me the fat titty. But at 41, I'm more senior, I'm more well-versed, worldly. I've sucked titties before, all consensually. Gotta get that preamble out of the way, or that whatever out of the way. It is odd. And I don't think I'm going to put this down because it blocks the sign right there. Verbal graffiti. And again, please subscribe if you have two big fat areolas that are symmetrical. And I think I'm correct in my assessment because there's no glory hole for the tit. Right? You have a glory hole to put your penis inside of. And then somebody sucks your penis on the other side of that hole. But there's no glory hole where a babe puts her big fat titties through the hole, and then there's an anonymous person on the other side of that hole in the wall sucking the tit. Right? Because getting your dick sucked is you know how that feels if that's happened to you. But that's why I think, the glory hole is actually quite odd when you think about it, because it is, the glory hole is actually height dependent. Because if you're below a certain height, your penis does not reach the hole to put your, to put your penis through to get sucked from an anonymous stranger on the other side of that hole. Or if you're too tall, you have to bend down or bend your legs to get your penis through the hole. And even though your dick is getting sucked by that anonymous person on the other side of the wall, you might not be able to enjoy the suck or keep your penis erect because your thighs are burning from having to bend down a little bit to put the penis where that hole, where the opening is. It's very, I've never been on a roller coaster, but I guess it's similar to that. I guess on a roller coaster, you have to be, what's the minimum height? I don't know, 5 feet, 5'5", 4'10", whatever it is. Hey, if you're not average height and you're a guy, the glory hole could really, it could be frustrating. Right? Actually, the more I think it out, if there's a glory hole, a restroom with a glory hole, there should be a step stool beside the glory hole. Therefore, shorter men can use that stool to reach the hole with their member. That only seems, in today's society where we try to be all-inclusive of all different types of people, the glory hole is not inclusive. Because if you're too short or you're too tall, you can't get to the hole. So there actually, there either should be a step stool or there should be multiple holes, multiple glory holes in one wall, so that whatever your height is, there's a hole that kind of levels out where your penis levels out. But again, the glory hole is only for the penis. Again, if there was a glory hole, if I went to a restroom at a club or a bar or wherever, somewhere in public, a park, and there was a glory hole there with a boob like popping through the hole with the areola and a nipple, and that's kind of how boobs work. There's a boob, and then there's an areola, and then a nipple, and there was just let's say one of them, not even two, just one boob hanging out of a hole in a bathroom stall. Would I suck it? I probably would because I'm the B-man. But again, it all goes back to the hot chocolate. Like, I'd suck it, but I'd walk out of the bathroom not getting any pleasure from it. Like, well, it's an experience. It's a memorable experience. But again, there's nothing pleasurable about sucking the tit. And also, I would use the toilet first before I suck the tit. All right? Like, that's crazy shit right there. Sucking the tit in a glory hole, out of a glory hole, and then using the bathroom, whether you're going number one or number two. What the B-man would do is I'd go number one or number two, and then I would suck the tit as I was leaving. Because I wouldn't want to make eye contact with the person who put their tit through the glory hole. I would just rather imagine it's some hot, floozy. I don't know. That's just how my mind works. Now I'm starting to think about if I was in a restroom and there was a glory hole there and then someone put their penis through the glory hole, what would I do? Now, again, I'm a heterosexual guy. I wouldn't touch it. I would but I would let him know. I'd let the gentleman know, hey, I'm a dude. I don't suck dick. Better luck next time. But again, yeah, but I do love sucking a tit. I do love sucking a tit. But really, it is odd. Humans are so fucking stupid. Yeah, obviously, you love sucking tit, but there's no taste to it. Yeah, hot chocolate, Fruit Loops, any type of candy, blow pop. A blow pop is so much more enjoyable, right? And longer lasting than sucking a tit. But we're always going to choose sucking a tit. That's probably why there's 6 billion of us on Earth. Because we always choose to suck the tit over doing whatever other food or liquid or nourishment to put into our mouth. If there's tits there, we're gonna nibble on those. But all right, enough of that. Enough of that. What was I going? Well, we're opening. And again, if you are a babe who likes having her big fat areolas sucked on, reach out to the B-Man here at Verbal Graffiti. All right, moving forward. I live in Connecticut and sometimes New York. All right, this comes from the subreddit Therapy. After that opening, the B-Man needs some therapy, and you probably need some as well. All right, yeah, this comes from the subreddit Therapy. Therapist wants to date me. Sorry for the clickbait title, but I'm unsure how else to describe it. Also, sorry. I have that hot chocolate in my gut right there. Also, throwaway because I don't want this associated with my main account. So this person is terminally online, which we like here at Verbal Graffiti. I've been seeing a therapist for the last year or so, and during our last session, he informed me he could no longer see me professionally because he is interested in me romantically. He further informed me that after 2 years in our state, it's allowable to date a patient. He seemed to think I would be both flattered that he wanted to date me and impressed that he had such strong ethics that he would stop seeing me due to his feelings. Which I guess is fine, but he didn't seem to consider the possibility that I wasn't interested in him romantically, nor did he apologize for dropping this all on me and then ending the session by telling me, think about it and get back to him. I don't even know what advice I'm looking for. Confirmation that this is not normal and something that people would find upsetting. I'm a little giddy that your therapist knows the laws in whichever state you reside of how the statutes of limitation with being a therapist and a patient, like how long you have to have a patient or be away from each other to fuck. The fact that he knows the exact time period or statutes of limitations tells me that he's done this with other patients he's had. And let's just get that out of the way. Hey, he wants to fuck you. And that's what all guys mean when they say, I'm interested in you romantically. When a guy says that to you, when a guy says, I'm interested in you romantically, that's a polite, coded way of saying, I would like to take my penis and put it inside of your mouth. What do you think? That's what he wants to do. And that's honestly, for the last year, that's what he's been thinking about. And I'm assuming you're doing like a Zoom call or like a web call weekly, because who goes sees a therapist in person anymore? So for the last year, when you've had your, let's say, your hour to 90-minute appointment weekly, I don't know, every Wednesday at 4:00, and you're opening up to this guy, this therapist of yours, about everything that makes you fucked up, that makes you a broken person. You had an avoidant mother. She verbally abused you. You had a cousin that was 2 years older than you that molested you when you were 7 years old. She stuck rocks and pebbles upside your vagina and your butthole. Your father, you don't know who he is. You're addicted to ketamine. You have trust issues. You're not able to keep any type of position or paid job for over 6 months because, again, you're addicted to drugs and you have attachment issues and you don't know how to make eye contact with people who are older than you, and you're just a broken soul, and you're crying to this therapist. And you're bemoaning the fact about your mother ruined you, how she didn't make a lunch for you, she forgot to sign the permission slips to go on the field trip to the museum or the Sturberg's Village or wherever you were going. She never signed the permission slips. She never had enough money to buy you Kool-Aid, so you had to drink those generic brand juices, the ones that come in like the grenade, the little grenade, and you had to pull the plastic, the aluminum off. It had kind of weird taste to it. You loved it, but you hated it at the same time. Anyway, you had a fucked up childhood because you were born into a fucked up family, and you were talking to your therapist every week for an hour, and you were crying, and you thought he was helping you, or that he was listening, when in fact, he just had a raging, erect boner underneath his computer camera, and he wasn't winking it, but he was thinking about shoving his erect penis and shutting you up by sticking it inside of your mouth and skull fucking you. That's all he's been thinking about for the last year. But a tip of my penis to the therapist for not vocalizing that and being professional enough to listen to you and all of your trauma that you've been bitching about. And you've been paying a hefty fee, again, for him to listen to. Now, I don't blame the therapist of yours for being sexually attracted to you, wanting to be with you romantically. How can I blame him? And how can you blame him? We've all watched The Sopranos, and if you have not, go watch The Sopranos on HBO. Get HBO Max, watch The Sopranos, one of the best series ever. We're not going to get into it, but if you did watch The Sopranos, you know where I'm going with this. Tony was sexually attracted to his therapist. I don't remember her name because I'm a misogynist, and I only remember the male characters of TV shows that I watch. But there was a sexual tension between the two of them. And Tony wanted to fuck his therapist, and the therapist wanted to fuck Tony. I don't remember if they ended up fucking, but I do remember them dreaming or having fantasies about fucking each other, or at least in the show. I think they had, like dream scenes or whatever. So, but again, of course Tony sexualized his female therapist because Tony Soprano sexualized every babe that came into his life. But where am I? I'd be more concerned if the therapist was not romantically or invested in you more than professionally. I'd be more concerned if a therapist of mine was not invested in me, in my life, on not more than a professional level. Because when you really think about what it is, your therapist or a therapist-patient relationship, therapist, patient, like the patient is just, they're bearing their soul, all their dark secrets, everything they're afraid to tell real people in their lives, they tell you, the therapist. So the therapist, how can a therapist not become emotionally invested in your life and who you are? Like the therapist who is able to keep that barrier up and just take all your information and not be emotionally invested, that's psychotic. That's the person now. That's the person who can do that could also be a serial killer. So when I think about that, most therapists can probably be a serial killer. If they're able to have 10 patients a day and not get invested in their patients' lives when they're talking about all their trauma, like that's psychotic. So if your therapist is initially physically attracted to you, the longer you have that therapist and you divulge your life to this therapist, of course, the therapist is going to want to put his penis down your throat and skull fuck you, till you tap out. So I can't blame your therapist. I actually, again, tip of my penis to your therapist for being professional enough to be honest with you. And honestly, like, fuck you. Your therapist was professional. He was in tune with his feelings. He let his feelings known to you. Like, he knew his feelings would interfere with his job of being your therapist. So he put an end to it. He shot his shot. And then you're being critical of him, where a lesser therapist would have just continued to get rock hard erections underneath the laptop camera as you talk for year after year. Like a therapist who was attracted to you but didn't have the balls to say it would just use the images of you in the spank bank. But this therapist, he was on, you were honest with I'm stumbling over my words. That hot chocolate, it's got me, whoop, whoop. You were honest with your therapist for this year. You dumped your trauma onto this therapist. And he listened respectfully, professionally. And the first time, after 1 year, your therapist is honest with you about one of his feelings about you, and suddenly you're going to point your finger at the therapist and come to Reddit and say and talk shit about your therapist? It's like, fuck you. You've been talking to this therapist for a year about everything that's wrong with your life. And the one time the therapist says something to you about how he feels, you're going to call him inappropriate? Have a little perspective. It's all about perspective, and you have none of it. But I will say, you got to find a new therapist because your life is still broken. Your soul is broken. But there is a victory. Most people who seek out the services of a therapist are broken forever. Their souls are broken. Their childhood was broken. They're incapable of finding love or accepting love. But the fact that your therapist listened to all your shit for a year and is still willing are still wanting to have a relationship with you, you should be giddy about that. That you're a unicorn. Most people who see a therapist for a year are incapable of love. But your therapist wanting to love you is a sign that there are still Johns out there that are willing to deal with your shit because you're that attractive and they want to love you. So even though, take this situation of what happened, and yeah, you got to find a new therapist, but there are still Johns out there that want to love you. and are willing to put up with your bullshit and your trauma to lay beside you in bed and spoon you and make you breakfast. When you, again, have perspective, because most people who have to see a therapist, nobody wants to spoon them. Nobody wants to make them breakfast in the morning. Yeah, maybe they want to fuck that person, but they don't want to be in a relationship, and they don't want any kind of commitment with that person who goes to therapy. So, but you are the outlier. So be happy with that. All right, we've gone about 30 minutes. I think that's enough for one episode. And again, if you're going to therapy right now, yeah, you're unlovable. The chances of you being in a happy, fulfilling relationship are minimal. And P.S., I've gone to therapy, so I'm right there with you. Go suck a fat one.